Hey folks, Matt from Sandhills Orthotics and Prosthetics, and today I'm going to help you put your best foot forward. So this is a flexible inner. This was taken out of a patient's socket, rigid socket. Typically we use these to provide relief in a rigid socket, but what we're looking at doing today is we're going to use this as an example to show, because of its transparency, what a loose fitting socket may look like versus a proper fitting socket. And so we have an example here, but I want you to see the difference between maybe what my hand going into the socket being a loose fitting socket. You could see there's rotation, and you could see a lot of times what happens to patients when they're standing, they're weight bearing on their prosthesis and it's not fitting properly. They're going to be beating the end of their stump up. They're going to end up with a lot of callousing or bruises or irritation at the end of their stump. And then also, they're going to experience rotation, loss of control of the prosthesis. That'll appear like the prosthesis is rotating on them as they're walking. Their toe will be turning out, or a lot of times patients will say they're getting knee pain because what's happening is back of the knee, this shelf right here is going to ride up a lot higher than it's used to riding up because the patient's going down further in the socket. So they'll either have irritation at the back here, irritation at the bottom here, or a rotation. And so some of the ways that we can fix this is by adding fitting socks. Now all of our amputees are getting a bag of fitting socks. You have single ply fitting socks and you have multi-ply fitting socks. So the single ply fitting socks are going to probably be the easiest to use in a pinch. And that's when patients are experiencing little to no fluctuations just throughout the day as they're going along, maybe when they're running errands in town. And then we have some patients that have pretty significant fluctuations throughout the day. And so then they might have to do sock math. And so what we're looking at is maybe this one, your prosthetist might have a different brand, but this one here has a yellow line at the top of the sock, and that indicates that is 3-ply. And then this one here is 5-ply. So if you take 2 of these single-ply fitting socks and 1 of these yellow 3-ply fitting socks, then that essentially would equate to a 5-ply fitting sock here. And so we encourage patients to carry their bag with them. We typically give our patients a carry bag just to help carry some of their supplies with them, or tell some of our patients to just throw some socks in their purse or their pocket, just to have with them throughout the day, because some of our patients are on dialysis, they're taking fluid pills that's getting the fluid moving, or they just have other various complications with retaining fluid, or the fluid swelling goes down over time. So essentially the difference that I want you to see is the difference between how this socket is fitting on a loose fitting stump here, where you're beating the bottom, you're rotating and that kind of deal, versus this example here where we're looking at something that has a sock on it. It's going to be more of an intimate fit. And so as I push this onto the mold here, you see it takes force, and usually patients will experience maybe 3 to 5 slow clicks when that's going on, versus zipping all the way down to the bottom of the prosthesis when it's a loose fit. And so as we can see here with this, when this is on the liner, it's engaged and it's locked. When the prosthesis is moving, the leg is moving too, because they're moving in sync due to intimate fit. And then you're not going to have as much, look at how hard it's going to be to pull the prosthesis off of the stump. It's not going to happen when there's an intimate fit. You're going to have more globally dispersed pressure, and that's going to equate to a better fit overall with the prosthesis. That might save you a phone call. Hopefully that helps you put your best foot forward. If you have any questions or concerns, reach out to your prosthetist. They might be able to elaborate on some of the additional things they can do, like putting padding, pretibial padding, ear padding. You may even notice some gastroc padding. Even with some of the AK prosthesis, you would essentially do the same thing, or some other measures like silicone padding that goes inside the liner. So hopefully this video helps you and stirs up some curiosity as far as what else you can be doing to better improve your goals and outcomes with your prosthesis. Take care.